Dwayne is in Los Angeles. Dwayne is a doctor. Dwayne, you're on with Larry.
Hey, Larry. I wanted to make a comment about the decline in healthcare issue that you brought up before, but I mean, I have to comment on your last caller in that you guys have revisionist history of Franklin Delano Roosevelt's initiatives for the social projects that he was interested in were on the heels of severe times in our country. So how you can say that was a flourishing time in our country was crazy.
Well, what I said was, he said there was a flourishing time. What I said was that at the time you're talking about 30 workers for every one retiree. Now we're talking about 2.5 workers for perhaps every one retiree, and we're also talking about a time when let me finish, Doctor. We're talking about a time when state, local, and federal didn't take nearly what is being taken from the American taxpayer right now, not even close. So he's right about the fact that we're piling on more government programs and expanding government at a time when we can afford it least.
Well, the whole thing he's right about was symptoms, and these aren't just symptoms of problems. These are symptoms of progress. We live longer. We've benefited from a lot of great advances in technology and medical care over the last.
Right. All the more, doctor. All the more reason to have less government, not more. I'll tell you what, doctor. Doctor, you hold on, okay? Don't go away. We're going to take a break. Don't go away. Dr. Dwayne wants to tell me that I'm wrong about being concerned about the quality of health care. We'll see about that, doctor. 1-800-222-KBC is the number. And Dwayne has remained with us. Doctor, thank you so much for staying on.
Thank you.
Okay.
Your statements about declining health care kind of go with an unstated implication that things are fine as they are, and they're just not.
Okay.
And if I can share with you
Wait. One more thing before you go on, doctor. I never said that our health care is declining. What I said was our health care will decline under Obamacare, and a majority of doctors feel the same way, that going forward, because of Obamacare, they believe that patients are going to get less quality care and innovation is going to suffer under Obamacare. That's my position.
Yeah, my point is it was declining steeply already. People just aren't honest about that. And I'll give you my unique perspective. I'm a subspecialty cardiologist. I'm black. I started practicing in South L.A., primarily delivering care to blacks and Hispanic patients in this area. I expanded my practice about 14 years ago to North Orange County, and I enjoyed great support from largely affluent, upper middle class, and predominantly white patients. And what's happened in the last 14 years between these disparate communities that I work in is that they're both declining. The decline has been steeper in the South LA area because the major medical centers couldn't handle the burden of the uninsured. In North Orange County, the small community hospitals, and there were many sprinkled all over those hillsides in Anaheim and La Habra, Placentia, all those hospitals started closing and consolidating toward the major medical centers that could survive in that climate. But now they're declining. They're restricting services because they can't handle the uninsured also. But so the major medical centers are still open in Orange County, but they're strained. The major medical centers in South LA started closing years ago. Daniel Freeman closed. Brotman is darn near closed. Robert F. Kennedy Hospital is closed. MLK closed for reasons both administrative and financial. So and the ones that are open are teetering, and or they're operating under schemes that aren't good for everybody. So something had to be done. Something is being done under the ideas put forth by Obamacare. And when I look at what's happened this week with this repeal it movement, yeah, but they've also had several months to come up with additional ideas, and I have yet to hear an idea from the Republican side about what's going to be done better. How can you augment doing at least something? Because it's definitely declining. It's declining steeply, and it's declining steeply everywhere. And it's not just a racial issue. It's affecting everybody.
Well, Doctor, you've made okay.
Easy to document.
Okay, Doctor, you made a lot of statements. 89% of Americans have health care insurance. Of that number, 85% say they're perfectly happy with their health care.
Hospitals are closing all over the country.
Supposedly, there are 40-some million Americans that don't have health care. I've gone over those numbers. A large number of those are healthy people making $75,000 or more and have made a decision that I'll pay for my health care out of pocket, or that I'm young and I'm very unlikely to get sick, and therefore I'd rather keep the money and spend the money or save the money rather than buy health care insurance. Several millions.
Argument for the mandate pretty well yourself right there.
So you should tell people to get health care insurance whether they want to or not? What gives you?
Hospitals are closing.
What gives you? Wait, doctor. See, the
I
reason.
don't believe that patients are happy. When patients have to deal with hospitals, then they realize they're unhappy because everybody's experience with hospitals are that they're not getting the services that they expect. Let me
for the moment accept your premise that the quality is down and all these areas that you mentioned are suffering because they're not getting the quality care that they need. Let me accept the premise for all of that, doctor. Here's my question. Here's my question to you. Assuming all of that is true, do these people have a right to demand health care from taxpayers?
We have a need for some strategy to keep things from declining at the rate that they were.
So your answer is yes.
So my answer is we need something. I haven't heard anything from the other side that even comes
No, doctor, just answer. First, we can't even have a conversation until you first answer this fundamental question. Do you believe that individuals have a right to health care?
Yes.
Okay, I don't.
And the mandate for that is stated in that hospitals cannot refuse patients. So if you don't want to require people to pay for insurance, then free the hospitals of the burden of having to take care of whoever shows up. No one's willing to do that.
I'm ready to sign up then, doctor.
You're willing to free
Absolutely.
The burden to show up?
People do not have a right. Hold on. Let me finish, doctor. No, doctor. Let me finish my question. Under our federal Constitution, Article 1, Section 8, because of my misfortune, because of my absence of health care, because of my absence of quality of health care, however you want to phrase it, I do not have a right to the labor of somebody else. I do not have a right to somebody else's money.
I'm not a constitutional lawyer, but
obviously not. And you don't seem to care.
If you want to free the hospitals of the burden to take care of whoever shows up, then I challenge you to drive across town without your wallet one day, have a car accident, and be taken to an ER, and then tell me how you feel if they turn you away because they can't prove you're insured.
Well, you see, doctor, you think that. Let me answer your question. You think that
and not require them to be able to pay us.
Okay, you think, doctor, that we to have the society that I believe we ought to have, which is that neither you nor I have a right to somebody else's labor. That we're going to be like some sort of a third world country where people are roaming the streets with guns and breaking into people's homes and dragging out women by the hair. That's not what's going to happen. Individual states are going to deal with it. I believe in federalism. You don't.
Central America and South America, and it's a travesty what happens when people show up at centers without coverage. They don't even let them in the door. We don't want that kind of society.
This isn't Haiti, doctor.
I want Americans to go to any of their favorite vacation spots in the Latin world south of us, and see what happens.
Doctor, this isn't the Latin world. This isn't south of us. This is a free economy with individuals making decisions, and their decisions are made to please customers. Medical care is no different than any other commodity. And if individuals were allowed to compete for the dollars, if government was not involved in it and regulating it to the degree that it is, we'd have a society where medical costs would be inexpensive and would be far more accessible than they are right now. The reason, doctor, you're complaining is because government has interfered so severely in medical decisions because people feel, as you do, that medical decisions are a right. They're not a right. They're a commodity. And if they're a commodity like anything else, whether they're TVs or computers, individuals will compete, doctor, and will deliver services cheaper and more quality than if government gets involved.
Any cost curve you look at, the biggest savings opportunities are with hospitals, yet the hospitals are required to treat anyone who shows up.
All right.
If you don't change how you handle that, so you're telling me you live in a society where hospitals aren't required to take care of people, and that's vastly different than what we have now. Yet our hospitals are closing. They're declining what they can offer because they can't afford to stay open under the current format.
I understand your position, doctor.
Explain. Documentable by looking at
I got you. Explain.
Years in LA.
Explain this to me then, doctor. Explain this to me then. Yeah. Why is it that plastic surgery, implants for hair, laser surgery, all these things that are not covered by insurance are getting cheaper and cheaper?
Well, they're getting cheaper and cheaper right now because nobody can afford them. Everybody was mortgaging their houses.
That's ridiculous, doctor. Answer my question. Why is it that people that want liposuction and facelifts and hair grafts and all that cosmetic stuff that you have to pay for out of pocket cash, that's getting cheaper and cheaper? Why is that?
Are you denying the fact that people weren't using their mortgages and the escalation of home prices and equities to
Doesn't matter how they're paying for it. My point is they're getting cheaper, doctor. Under your philosophy, all these things should be getting more and more expensive, and they're not.
People can't do that anymore. The well of money that people were going to get to pay for those things is dried up. Plastic surgeons have seen 40% declines in their business in the last 2 years. Ask any one of them. A lot of them have closed and gone into other things. Those guys that had cash practices are not practicing at the same volumes and not nearly asking for the same prices that they were before, because the well of money that people were going to, which was primarily their homes and their equity values, they can't access anymore.
Are people having fewer plastic surgeries now, doctor, or more?
Oh, absolutely. Everyone I know has seen 25 to 40% decline in their business.
Are people having fewer plastic surgeries or more? In other words, are hair plants and facelifts, is that a growing business or a declining business?
Since the recession began in 2007, the plastic surgery business has declined significantly. The surgery center business, where doctors were doing elective procedures in their own centers, that's declined. A lot of them are closing their centers. That's easily verifiable.
Would you argue, are you telling me now that because plastic surgeons are making less money, assuming that they are, the plastic surgeries that they perform, they're not getting cheaper? They're not getting less expensive? At one time, plastic surgery was something that was done only by only wealthy people. Now middle class and lower class people are getting plastic surgery. And these are not procedures that are covered by insurance. Why? Because people are competing, doctor. No matter what the service is, if you allow people to compete, it will get cheaper. That's why they're getting cheaper.
No, you follow for the cost curve thing. Those costs were going up because when everybody was doing them, when people had free money to access from their equity in their homes, everybody was raising their prices despite the competition.
Well, doctor, we're just going to have to agree to disagree. Thank you very much for the call. Anybody that performs plastic surgery